got a few more people here who would like to comment on. If you have any question, you can ask us. So yes.
Okay, so I like the way she starts, like she introduces to the examiner the way it happens in the exam, so that you can have a practice of it as well. And then she introduced herself, she asked the consent, and then she asked about the seizure, and before, during, and after. She didn't ask about the aura. Otherwise, she asked all about the before, during, after. She did the DVs. She ruled out meningitis and NCAF and stroke as well. Not stroke. I think she forgot fast. And
Yes.
other than that, she did the past medical history, and she asked about the medications. She asked about smoking alcohol, and then she explained really well. What I felt was lacking in the consultation was that maybe you could have involved the patient a little bit more, like, oh, this was the first time he was having a seizure, so maybe you could have acknowledged and said something about it. That's I'm really sorry. How do you feel about it? Was it your first time? So this question, was it your first time, could have been asked earlier in the start. Other than that, obviously you were going fine. You could have asked about the DVLA if you would have time. Driving is important.
Right. So yeah, this is a consultation structure. You can see that she was. We just quickly go through that, and you can see that how she could have done in better way. So explaining findings and everything. Did she explain findings or not?
Yes, she explained the findings that you are having a fit
Psychosocial
and
part,
electrical activity.
examination, simple words and consents, everything was there. Uh,
Yes, she had the
Management
examination.
agency order was done. Admission,
Yes, first clinic,
that was done.
all
So basically,
patients.
guys, I want to teach you the most important thing. Binit, you're here with me. Binit, can you hear me? Binit, can I see you on the camera? If that possible, can I see you on the camera? Binit, if you unmute your mic, I assume you're not sleeping.
He was
Binit,
here with us. He was station yesterday.
okay, so Binit, I think he might be busy at the moment. No problem. So basically, whenever you guys are practicing, you need to do one thing. First, try to make a structure of your consultation. So she was good, Sony was good. She know that she'd been practicing long period of time. Sony is taking over lot of free sessions. So introducing yourself with your second name, she was know that how to do the appreciation. So little bit appreciation missing that. Thank you for coming in. Thank you. You've done the right thing. Okay, well done. You're right at the safe place. I'm very happy that you're here now. Or similar thing. The appreciation should be there. Number one. Remembering the setting of consultation, that could be ED setting. So you think what you can do further. Identify the type of consultation. It's just first consultation, and in the incident history was very important. Presenting complaint, you did ask who has witnessed, anyone took that picture. These are the few questions would have been asked, added on that. Appropriate history tools. Yes, she used the appropriate history tools, like when it started, how does it start, it has happened before, anything like that. Head nodding, definitely like audio consultation, simple question. Focus history can be improved a bit more about that. And then general health tools, so previous things which could be connected with the fits. Family history was very important. That family history of running epilepsy or something like that. Fever was again there. Social aspect of history, anybody lives with you, so that if it happens again, that anybody could support you in that. That was missing. Idea, expectation, consent can be improved a bit more, but that was done fine. Psychosocial was not very important here because it's the first episode. Examinations can tell in more important way what examination you need to do. That I would like to assess you. See for any injury on your head or I would like to check the nerves of your face, arms and leg. Finding explain the diagnosis, you've done that. And management is an urgency order. That means it's not urgent, but you will not immediate, but it's urgent, like in 2 weeks' time, they would do that. And do the safety netting. If it happens again, what to do. And referral, you done it. Shared plan, you need to keep asking patient what to do and what not to do, and what are the reading material you will be offering. That was fine. So again, I'm going to share the screen for the first fit again, that you will need to know that where you might be lacking. So again, check what actually happened. Incident history, who have seen that before, during, after. You need to speak that thing. And you need to ask about, by any chance you bit your tongue, or you swallow yourself, you was confused after that or not. That is my top question you need to think about. First time any video, anyone witnessed that, anyone video was made or not, any head injury, by any chance fainted or lost consciousness. That's the top question you need to ask. Then you will do some reassurance. You must appreciate them, you are here. Weakness, how they came to the hospital by ambulance, who brought you here, who have seen that incident, any video there. Try to gather more information. Then fast, flurry speech, bang your like weakness in your, everything was fine. Rule out meningitis, early morning vomiting and everything. These are the things which could be related to the tumors. Because, and then coming to the family history, I'm sorry to alarm you, any history of tumor or anything like that, you would ask. Diet, exercise was not that important here, but stress was important here. The triggers was important here. Driving need to be asked. I don't think Sony did ask about driving.
No, she didn't.
She didn't. So that's maybe in this scenario, the driving was the main thing to ask. If she's driving,
Yes.
so that you might not able to get good score because you didn't ask driving. So I assume Sony, can you hear me? Can you unmute your mic?
Yes, I can hear you.
So the most important thing what we need to understand here, the most important thing we need to understand here, that the top thing is driving. So because if you're sending someone on the first fit clinic and you're letting them drive, that's not a safe. Okay, that's very important.
Yeah.
Concerns, ID expectation concern important, and the examination you need to verbalize everything, how to do that. Okay, so let's do it before we go for the break. Let me do it myself, and Ramesh will become the patient and examiner again. So it's a jerky movement of the body, often caused never found. So you will explain never found. 50% of people never had another episode, but further investigation is required. You will explain reassurance. Urgent referral first fit clinic, and you need to mention what tests you would do in the A&E. So you didn't mention all those tests as well. And you would say we might need to consider if the CT scan required. If the CT scan required here, an indication of CT scan, then you would do. Otherwise, they might be that might be considered by the neurologist. Neurologist will see you, reassess you first seizure clinic. You may have further investigation. If epilepsy is suspected, treatment option will be discussed. First seizure leaflet until being seen by clinic, please inform DVLA of your suspected seizure and not drive until they have given you permission to do so. This may depend on the advice from specialists. Inform family, friends, relative to keep you if happen again. Safe place, call help if greater than. Okay, so let's do it now. So
Okay.
Ramesh, so let me do it with you, and we'll quickly do it again so that I'll try to demonstrate how it can be improved on. So Binath, you are here? Binath. I think Binath is maybe sleeping. 8-minute timer. I'm going to put 8
Okay.
minutes. Sorry?
Do you want me to put the timer or are you putting it?
Whatever. Let me put myself. Okay.
Okay.
What's the name of patient?
Anything.
Okay. Lita Brown. Okay.
Okay.
Enter the room. Hello.
Hello.
Hello. This is Dr. Zafar. Is this Lita Brown?
Yes, doctor, it's Lita Brown.
Is that okay? I call you Lita?
Yes, Lita is fine, doctor.
Nice meeting you, Lita. I just need to double check your age. What's your age, please?
Doctor, I am 45.
Oh, 45-year-old. Thank you very much, Lita. I understand from my notes you came to hospital by an ambulance. I'm sorry to hear about that. Can you tell me more about it?
Well, yes, doctor. I was at my home and I had a fit, and my husband, he called the ambulance and we came to the hospital.
Oh, okay. That's done well. Then you are here in the hospital. You are in a safe place now, definitely. So I need to ask you more questions about that incident. Can you please tell me more about that when it has happened?
Well, yes, doctor. It happened like 3 hours ago, and I was sitting on the sofa, and we were watching TV, me and my husband, and suddenly, I just became stiff, and I started shaking. I don't know, and my
Okay.
husband told me that you are having a fit, you are having a fit, and I don't know what really happened.
Okay. You are aware of all the incident which has happened, or you don't remember everything?
Well, yes. I remember just half of it.
Okay, half, no problem. So let's start from when it happened. You mentioned that you were sitting on the sofa. Any specific significant thing you remember happened? Any flashes of light or something like that?
No, doctor. It was just sudden.
Okay, it was sudden. And any headache sort of thing that significant triggered, I'm trying to ask before that you have.
No,
No, okay. While during that, when you was stiff and your husband was all the time there, anyone else was there?
no, doctor. No one
By
else
any
was
chance, your
there.
husband or anyone able to record that fit or not?
No, doctor, no one
Okay,
could
okay,
do.
all right. Definitely that was a stressful situation anyway. So during that, have you felt or your husband told you you wet yourself or soiled yourself?
No, doctor.
Okay. Any tongue bite?
No, doctor.
No tongue bite. Okay. And after that incident, was you confused at all?
Yes, well, I felt confused and I really didn't remember what really happened during the fit.
Okay, so you don't remember. Okay, no problem. So I'll be taking care of you. Don't worry. So you don't need to over stress about that. I'm happy you're here. Okay, definitely it's a stressful situation at the moment. So let me ask you more questions. At the currently, how are you feeling at the moment?
Yes, I feel a bit dizzy, otherwise, I'm fine.
Dizzy mean you feel lightheaded?
Yes, yes, something like
Okay,
that.
okay. Any headache at the moment? Headache at all?
No,
Okay. Any weakness you notice on your face,
no, doctor.
on your arms?
No.
Do you feel sick at all?
Yes, I was feeling nauseous after the fit, but I
Mhm.
didn't vomit.
Okay, okay. And recently, you've been having any fever or flu, like high temperatures?
No, doctor.
Okay, okay. Have you noticed any weight loss recently?
No, doctor.
Any lumps and bumps in your body?
No, doctor.
Any weight changes current recently, have you noticed?
No, doctor.
Okay. You're walking fine, you feel like your walk is not affected or something like that?
Yes, doctor, everything's fine.
Ah, okay, that's good. And by any chance, did you feel like you hurt yourself, you banged your head that time?
Oh, no, doctor, nothing like this
That,
happened.
that's good. That's 100%. That's definitely reassuring me that you didn't bang your head. Okay. Apart from that, you're after that, before that, you're eating, drinking well. Yeah.